use the word synchronized, even though it's one cow. So that's where the terminology may not fit exactly, okay? But the real thing is at least multiple cows. So usually if you have 20 cows, you want to try and get on the 23rd of November, everybody coming into eat roughly around the same time. So maybe 22nd, 23rd, 24th, that kind of thing. Okay? So if we have our refractory period and the animal is within that refractory period, what will happen if I give prostaglandin on this point, nothing will happen. So the animal will just continue as if you didn't interfere, right? But when you come back 11 days later, okay, the animal will now be wherever it was, plus 11. All right? So then we have, say, the animal being on day 6. If say it was, say, day 5 or so, you get to about day 16, you get rid of progesterone, and the animal should ovulate. Okay? This one should ovulate. Okay? It's not a perfect science, so you never ever get 100% takeout. Okay? Now, if you were outside of the refractory period, and say you want about, how much you said last time, about day 7 or so, day 7, day 8, right? And you gave prostaglandin, you took away that progesterone, right? This animal should ovulate in about 3 days or so. Okay? So what that means is that if you come 11 days later, you've already utilized 3 days to get the animal back to 0. Yeah? So that means that when you come 11 days after the first injection, you're now about 11 minus 3 days into their second cycle, their new cycle that you almost stimulated. Okay? And similarly, if you go after luteolysis has already occurred at day 17, day 18, again, nothing happens. Okay? This animal will come into heat on her own. Okay? And she will take how many days to take. Now, if your synchronization protocol is just about getting the animals in heat, this animal will come into heat on its first injection, as will this one. Now, if you don't care and you're trying to save some money and not have to give a second prostaglandin injection, you could just serve these animals on night. They won't then be everybody lined up, but they'll have some cows will be here and some cows will be 12 days later, right? It depends on what you're trying to achieve, right? If the whole point is synchrony isn't a great goal, but coming into heat and being obviously coming into heat, then save yourself an injection, right? Because the prostaglandin costs money, the needle and syringe costs money, the labor to hold the animal and do everything that costs money. So you have to then decide what it is you want to transition. Okay? Similarly with the OBSYNC, if you have GnRH pushes LH and causes an ovulation, right? So once we have a viable follicle, a viable dominant follicle, you give GnRH, you're going to get an ovulation. Okay? And that's regardless of whether you have progesterone in the system or not. Okay? Because if I walk up there with a packing big dose of GnRH, I don't care about progesterone. It's not going to stop me. Okay? Progesterone typically stops the release of GnRH. But you've come with your bottle. So you don't care. Alright? So you cause that ovulation, and when you cause that ovulation, you now have the same sort of situation where you're trying to get, when you come back, PG on day 7, you're trying to get a non-refractory corpus luteum, which will respond to that prostaglandin on day 7. Okay? And that means that hopefully the ovulation took place within 1 24-hour period. Because you only have 7 days to play with. Yeah? So if you take away one of those days to ovulate, you have 6 days. So hopefully by the time you come, it's not still within the refractory period. Okay? And we were speaking about this yesterday that, well then why did they pick it? And I am certainly of the opinion that they just pick it because 7 days is a week. And I think they really should have done 8 and 10. Yeah? So you could play with that if you have thing. If you're trying to do a system, you could do an 8-10 day window and see how it works. Okay? Because 7 as the standard of sync protocol actually has errors built within it. Okay? Don't think just because somebody did it and everybody says, oh, sync, that is all brilliant and right? Sometimes it works. With the cedar, we put the cedar, and the cedar is a progesterone releasing device. Right? So the cedar, what the cedar does, it mimics this progesterone. Right? Where we have problems, we now have control of progesterone. If the cow herself is not producing progesterone, and we don't know if she's producing progesterone. So that's our big thing. So what we can do is we can either eliminate progesterone at the start or eliminate progesterone at the end. Co-progesterone, not the cedar's progesterone. Right? This drop in progesterone from on about day 17, day 18, right, takes about 24 hours. Okay? So essentially, prostaglandin, whereas you could take out a cedar in 5 seconds, prostaglandin is a lot slower. So it'll take 24 hours. So you have to marry the two. So in other words, in order to achieve basal concentrations at the same time, you have to give prostaglandin a day before you yank out the cedar. Yeah? Do you understand that?
How long time before? 24 hours?
24 hours before.
Oh.
Yeah? So you yank out that cedar. Right? So you get a sudden drop off in progesterone.
Oh.
And this sudden drop off in progesterone says that's the hypothalamus who let's push some GnRH.
Yes.
So it's almost like giving a GnRH injection. Okay? And I tend to like a 10 to 14 day window, and we were explaining yesterday that we do have some variability to play with, and a lot of it depends on when you want the cows to come and eat. Because after you do the yank, right, cow will come and eat probably about 3-4 days later. Okay? So you want to decide when you want that 3 to 4 days to fall. If you don't want it to fall on a weekend, or you don't want it to fall on a religious holiday or something like that, you can play with it a little bit. But you have to be viewing 2 weeks down the line. You can't just be viewing it here. You have to think, okay, well, I'm going to do this, I'm going to do this, I'm going to do this. And then on Thursday next week is likely when she's going to come into it. Alright? So, when we do ultrasound scanning, so ultrasound scanning is genital tract evaluation, which is manual palpation. It involves pregnancy diagnosis. Pregnancy diagnosis, obviously, the important thing about pregnancy diagnosis is us trying to identify as early as possible and as correctly as possible. Right? We don't want to be saying it's pregnant and then, well, we're not sure. Right? If you say it's pregnant, we think it's pregnant, right? I'm not saying that there won't be times when you go, I'm not sure, and you'll come back and check. Right? But you want to try and get it accurate. And with ultrasound, we can get it down to about 32 days or so. I see people going 26 days. I've seen things where if I see it, that it is pregnant, I can be confident it is pregnant. If I don't see it, I can't be confident it isn't pregnant. If you understand the difference. Yeah? So I have picked up maybe 26, 27 day pregnancies. But typically I'll pick up maybe a 32, 33 day pregnancy. Right? And the reason you have that push for why you have this big push is this idea that we should have milk production, right? So this is the amount of milk produced, the area under the curve, right? We know you're going to get peak lactation in about 6 to 8 weeks, okay? And if we want, now I don't know what you aim for, right? In the Western world, the big thing is a calf per cow per year, right? So the intercalving interval is 1 year, okay? Which means by here you have another calf, right? And that means that you stop milking at